Hi, my name is Heather Happy. I'm a licensed esthetician at Cool Springs Plastic Surgery, and I'm here with Albert Hacker. He's an area manager for Sciton. And we're here to discuss all the wonderful benefits that Sciton technologies can offer for your skin and your skin concerns.
Well, thanks for having me, Heather. So here we utilize Broadband Light and lasers. So those are two different varying forms of energy. So many of you probably have heard of IPLs. BBL is Broadband Light. So it's like an IPL, but it's a lot more sophisticated, a lot more tunable. That allows them to treat much more specifically when they're going for a certain need that a certain skin type may have, instead of just having more limited options. Basically, Broadband Light is the entire spectrum of light. It's like a miniature sun in your hand, and you can target that energy to hit different targets at different depths that exist in the skin. Here you're looking at probably pigment corrective, reds corrective. So if you're looking at reds, support wine stain, rosacea, facial veins. And then we're looking at specific wavelengths of energy that are known as lasers. Here they utilize halo. It's a very diverse, most tunable, sophisticated laser system in the world. And that'll treat texture, tones, pigments, reds as well, wrinkles, scars, and you get a substantial pore reduction for a great number of time, a long amount of time when you're looking at that treatment post-care. You can combine those things together and have kind of a special effect, or you can kind of take each independently depending what your specific needs are to hit those targets and your time frame of downtime. So really they have a whole toolbox of things to put together a treatment package to hit anything that you need for your skin.
So we see patients every day in the office that fall into basically two different categories. We have the preventative category and the corrective category. So the preventative category seems to be patients that have very limited or little amount of sun damage or premature aging, and they really want to do all that they can to keep their skin beautiful and healthy long term, and that's more the prevention category. So the devices that we use with Sciton really helps with that prevention. Then we have the corrective category. So these are patients that have been in the sun a lot, or they have had acne scars or lots of texture, lines and wrinkles, things like that, and they want to start correcting the damage that has been build up basically over the years. Then once we get through the corrective stage, then we can start maintaining and preventing future damage. So once we get a patient into the treatment room, we want to customize a plan based on the skin concerns. So like you mentioned, different issues that we would correct with BBL or halo or address. Brown pigment, so that would be sun damage, freckling, uneven skin tone, redness, which a lot of people have general redness in the skin, broken blood vessels, rosacea is one as well. Lines and wrinkles, pore size, texture, dull, uneven skin tone. Once we decide what the main issue is that patients want to correct or work on, then we can customize the plan. So oftentimes it's BBL alone. Sometimes it's maybe halo or TRL if they need something a bit more advanced, which you can talk about that a little bit later. And sometimes we combine them together and do BBL and halo. So BBL, that is probably the most popular treatment that I use with Sciton because I feel like it's more of a jack of all trades kind of treatment. It works on red and brown pigment, and it also stimulates collagen. But it's important to mention that BBL is not a laser, it's pulsed light.
Whenever I start talking about a consultative approach when I'm talking with a provider about BBL, you kind of got to categorize treatments in terms of age groups, age blocks. So Broadband Light has the widest variety you can have. We go 18 to 80. We do the pigment corrective, we do reds. You can also cure acne with light using BBL. And we have for prejuvenators, you can start as early as 18, but you can begin later in life if you haven't started. I mean, we're in the South. Everyone loves the sun in the South. We're fighting it every day. We all wish we'd have worn more sunscreen when we were younger. So eventually you got to come back, and that catches up with us, varying, depending on our age, our skin type, how resilient that skin type is. BBL kind of allows you to kind of recondition your skin and turn back time. One of the studies that we have, speaking of that, is Forever Young, which is it was done at Stanford University out in California, and they took this huge group of population of patients, and they had over 400 doctors, dermatologists, guess the age of these patients. And at the beginning of the study, they all guessed their age of their, just by the look of their skin, on or within about a year. And then they took those patients out 8 to 10 years using our Forever Young protocol, and which they utilize here. And that's kind of more the prejuvenation or anti-aging portion of BBL. And then the doctors unknowingly at the end of that time frame, 10 years later, get the same patients 10 years younger. So that's when they started looking at the skin cells DNA. And they discovered that using this certain way, flashing this light in controlled depths over controlled periods and frequencies of time, that reactivates RNA in your skin cell's DNA that was dormant in your 20s. So basically, your skin cell, layman's terms, your skin cell behaves like a younger skin cell every time you come in for your treatment.
I think based on the Forever Young study, we recommend at least 3 right off the bat, and we like to do them monthly just because in Tennessee, with being in the sun, we have a shorter window of time where people are more indoors. So typically from kind of October to March is when I try and get people in for their 3 before the summer and spring activities start off. And then at least once a year, if not twice or 3 times a year, depending on the initial damage that we're trying to correct, that would be the frequency of how often I would do that.
I also like the Forever Young because it's more of an all-in-one too. I mean, you're clearing your canvas, what you say. So we're getting all the bad stuff out. We're erasing the damage for years of sun. We're taking out those pigmentations. We're taking out those stacks of melanin that are in the skin if you're a FITS 1 through 4 that you probably wouldn't have otherwise, a giant freckle, a big mole. Some sun damage, and that's basically what freckles and pigmentation is. Your skin cells defending itself against the sun, and this helps erase those, and it makes, as you're making the skin behave like a younger and younger version of the skin cell, a younger skin cell is a more resilient skin cell. It's a healthier skin cell. It's more luminous. So the overall benefit it has a greater benefit than just having corrective treatment alone.
Now, you mentioned FITS 1 and 4, which probably nobody outside of the medical community knows what FITS 1 through 4 is. So we basically have skin tones that we categorize basically number 1 through 6. So BBL and IPL, either technology, those are not appropriate for skin tones that have more melanin in them or just darker skin tones in general. So that would be patients that have very dark brown to black hair, dark brown eyes, dark brown skin. And the reason for that is this pulse light could hypo or hyperpigment the skin. And that's a complication that we really need to avoid with BBL. So that's the main contraindication with BBL as far as skin tones. And then sun exposure is another big concern where we don't want people to be out in the sun before or after a treatment. Just lots of complications can come along with that. During the consultations, we always really educate a patient on sun exposure, the rules, things like that. The next one would be halo, and that's another popular treatment in our office. I like to do BBL and halo together for just reasons of ultimate skin rejuvenation. But there are patients that they go through their BBL treatments and then they just need a little bit more, and that's where the halo comes in. So the halo is a resurfacing and retexturizing treatment, and that's an actual laser. So different than the pulse light, but it is a laser. That's where we see more refinement in lines and wrinkles, texture of the skin. It works on deeper pigment, deeper sun damage, kind of pulling that out from epidermis and dermis. Pore reduction for halo as well, scars, so acne scars, surgical scars, that can be addressed with halo. More downtime with halo than what there would be for BBL, but most people find that it's worth it with the halo.
Halo is driven by erbium. Erbium it's a laser that just focuses on targeting water. So it's going to engage that. You can adjust and tune your energy to hit different targets at different depths in a different way than broadband light because it's a lot more controlled. It's like it's laser precision, right? And
with halo, with customizing in the treatment room during the consultation, oftentimes patients have multiple things that they want to work on: reds, browns, vascular, pores, or things like that. And so whenever I'm doing the halo, I reiterate what their concerns are right before I do the treatment, and then I customize. So I might treat the forehead differently than I treat the pores on the nose. And if they have a lot of lines and wrinkles around the mouth or a lot of the smile lines, I might treat that differently than I treat another part of the face. So I essentially will patchwork my halo treatment to customize it for exactly what they're looking for. So I might be a lot more aggressive around the mouth and not as aggressive up on the forehead if there aren't big issues. Halo, let's mention, that is appropriate for all skin tones. So the BBL, we have some restrictions on skin tones that we can do, and that's just for safety and complication reasons. But the halo, we can treat every skin tone. They're treated differently, so we are a little bit more conservative with darker skin tones to prevent some complications. But all skin tones can be treated. Whenever we do lasers, we pre-treat with a pigment corrector and a retinol prior to doing the halo. That just helps to stabilize the pigment in the skin, give us a better result. It helps with the healing time as well. So those are the prerequisites with halo: is we pigment correct retinol, and then obviously we use a sunscreen with that.
I always love talking with providers because I learn something new every time, so
Yeah.
it's good.
Yeah.
Yeah, erbium goes after water, so it's all fits all year. I mean, water's colorblind, right? So if you're hitting that, that's the target you're going to go after.
Yeah.
And they can adjust those energies to attack what you need to do. You've got a clear face up here, but you have some wrinkles here. You can do a polish here. You can do a heavier treatment here. If you have an indentation here even, I mean, she's got a single spot erbium that she can put and do a little circle around it and throw some deep thermal wounds in the middle with a halo, and there's all kinds of magic you can do. Basically Bob Ross with a laser at that point.
We can do lots of tricks. Now, we talked a little bit about TRL just briefly, that it's more of an advanced laser. Because we do have plastic surgeons in our office, TRL is utilized by our surgeons because it's a much deeper, more advanced laser. They oftentimes pair TRL or sometimes CO2 during surgery. So if somebody's having a facelift or maybe some fat grafting or something like that, they might do a TRL or a CO2 over that.
TRL is total resurfacing laser. Actually, so Sciton's founder, Jim Hobart, he invented the CO2 laser. Scientifically speaking, if you look at it, you want to have, when you're targeting something with laser precision, you want to hit that target with as little residual trauma to the tissue, the surrounding area that you're treating. That's why we go with erbium, because it's got a 15 to 16 times greater absorption with water in the cell than CO2 does. So when you're doing controlled treatment like a halo versus a total ablation like total resurfacing, basically you're aerating the lawn with halo, and then TRL and CO2, you're basically just mowing the grass. You're shaving off decades of skin, and you're going down so you see your clinical endpoint, which is typically blood, and unless you're doing a lighter treatment. You can also tune that as well. You can be on the nano peel with TRL. We call it resurfacing perfected, because it's what it is. You can go and it's like a dermaplane, but with lasers you're taking off the stratum corneum, so you're gonna have a nice shine after 2 days, or you can really go deep in someone's skin or resurface deep, and you can shave off 20, 30 years if they can sit out like a week or two downtime.
And that's what whenever we have patients that just want more than what we can provide non-surgically, that's when we refer them to one of the surgeons to have a consultation on a deeper laser, because they're not going to see a surgeon for a light little, laser treatment. They want those decades shaved off.
Oh yeah.
So
it's all kind of just a game of, like I said before, with BBL, it's more BBL's 18 to 80. Halo's going to be give or take. I mean, you may have some prejuvenation patients, like you said. They maybe want to come in for a 5% halo and have a nice polish during the summer or something like that. That's going to be about, no matter how intense your halo, it's going to be about 5 or 6 days of just sloughing, with your
and swelling.
Yeah, a little swelling. If it targets water, so if you swell, you got a really good treatment. So don't be put off by that.
Yeah.
But you can pretty much mitigate that and control that over a weekend if you want to. Deep resurfacing, it's probably more for the patient that's like 55 to 60 and above.
It's a treatment that I'm just thrilled to be able to do. I love it very much.
And you can control, we have, it's so tunable, you can actually add the benefits of CO2 without having the byproduct. Again, like everything with Sciton and all of our treatments are customization. So BBL, you've got you can wear makeup, cover up your stuff, your dark spots, anything that you treated. That's instantaneous, no downtime. Halo, a couple days, give or take, depending on how much you swell. Some people swell, some people don't. But you can wear makeup after 24 to 48 hours. TRL, you're out for a couple weeks, but it all depends on what you need and what your outcome wants to be.
And that's how we can customize it and determine what treatment each patient wants based on what their skin concerns are, as far as downtime and all. So, well, we hope that this information that we provided for you has been helpful, and that we've provided you with really good information. And thanks for watching.
Yeah, if you have any questions, give Heather a call.